Non-alcoholic fatty liver disease management. Non-alcoholic fatty liver disease, NAFLD, is a spectrum of liver conditions characterized by fat accumulation in the liver, managed through lifestyle modifications, medical therapy, and monitoring. Overview. Non-alcoholic fatty liver disease, NAFLD, is a spectrum of liver conditions characterized by fat accumulation in the liver, managed through lifestyle modifications, medical therapy, and monitoring. It is a common metabolic disorder associated with obesity, insulin resistance, and chronic inflammation. NAFLD can progress to non-alcoholic steatohepatitis, NASH, which may lead to fibrosis, cirrhosis, or hepatocellular carcinoma. Management aims to reduce liver fat, improve insulin sensitivity, and prevent progression to more severe forms of the disease. Pathophysiology/mechanism of action. NAFLD is primarily driven by metabolic disturbances, including insulin resistance, hyperlipidemia, and chronic inflammation. The liver compensates for these disturbances by accumulating fat, leading to steatosis. Insulin resistance, a hallmark of NAFLD, impairs the liver's ability to regulate glucose and lipid metabolism, promoting lipogenesis and reducing lipolysis. This leads to the accumulation of triglycerides in liver cells, resulting in steatosis. Chronic inflammation, often mediated by cytokines such as TNF-alpha and IL-6, further contributes to liver fibrosis and dysfunction. The pathophysiology of NAFLD is complex, involving multiple systemic and hepatic factors. Clinical features/indications. NAFLD is typically asymptomatic, with the majority of patients presenting with mild to moderate steatosis on imaging. Common clinical features include obesity, hyperlipidemia, and type 2 diabetes. The condition is often diagnosed through ultrasound or magnetic resonance imaging, MRI, of the liver. Indications for management include the presence of steatosis with associated inflammation, NASH, insulin resistance, or metabolic syndrome. Patients with NAFLD may also present with symptoms such as fatigue, weight loss, or abdominal discomfort. Diagnosis/monitoring. Diagnosis of NAFLD is primarily based on clinical evaluation, imaging, and laboratory tests. Ultrasound is the first-line imaging modality, with a sensitivity of 80 to 90% for detecting steatosis. MRI with magnetic resonance elastography, MRE, provides more accurate assessment of liver fibrosis and is preferred in patients with suspected NASH. Laboratory tests include liver function tests, ALT, AST, ALP, bilirubin, lipid profile, and glucose levels. The presence of insulin resistance, obesity, and hyperlipidemia is strongly associated with NAFLD. Monitoring involves regular follow-up to assess disease progression, liver function, and metabolic parameters. Treatment/management. Management of NAFLD is multidisciplinary and focuses on lifestyle modifications, pharmacotherapy, and monitoring. Key components include weight loss, dietary changes, increased physical activity, and pharmacologic interventions. Weight loss, even modest, can significantly reduce liver fat and improve insulin sensitivity. Dietary modifications should aim for a calorie deficit, with a focus on low-fat, high-fiber, and low glycemic index foods. Physical activity, such as aerobic exercise and resistance training, is recommended to improve metabolic health. Pharmacologic therapy may include agents such as pioglitazone, metformin, or fibrates, which can improve insulin sensitivity and lipid profiles. In patients with NASH, fibrosis progression is a concern, and treatment may involve anti-inflammatory agents or lifestyle interventions. Monitoring is essential to assess liver function, metabolic status, and response to therapy. Key clinical points. 1. NAFLD is a spectrum of liver conditions, ranging from steatosis to cirrhosis. 2. Management focuses on lifestyle modifications, including weight loss, diet, and exercise. 3. Insulin resistance and metabolic syndrome are key risk factors and indicators of disease progression. 4. Monitoring liver function and metabolic parameters is critical for assessing disease severity and response to treatment. 5. In patients with NASH, fibrosis progression may require additional interventions, such as anti-inflammatory therapy or lifestyle changes. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.